Oh, it's going? Okay, so first I'm gonna do the growth hormone pathway. So I'm gonna try to draw just like the whole pathway, and then we're gonna look at where each of the drugs come in. So this part is fairly straightforward. So first you start off with the hypothalamus. And the hypothalamus, for this pathway, releases two things, but let's go with the first one first. So the thing that stimulates it is going to be the GH. RH, the growth hormone releasing hormone. That's going to go to anterior pituitary. And that's going to cause release of the growth hormone. All right. So the growth hormone, it does a few things. By itself, it does have some effects on the target tissues, but most importantly, it goes to the liver. So it does two things. It has effects on other tissues, and then it also goes to liver. What it does in liver is it induces the release of insulin-like growth factor 1. And then that also feeds back to other tissues, and then that kind of augments the effect of growing, essentially. All right. And from here on, so hypothalamus doesn't just release the growth hormone releasing hormone, it also releases somatostatin. So it releases somatostatin. And this is an inhibitor for this whole pathway. So you can imagine, like, when there are drugs, it can, depending on which one it mimics, it can have different effects. And the effects of growth hormone and insulin-like growth factor, it basically gets your body ready to grow. So to grow, you're going to need more glucose in the blood, so it's going to increase glucose in blood, and it's going to increase fatty acids in blood. And then this is also going to increase the protein uptake into cells and increase protein synthesis. Let me just erase this because there's a little bit of difference here. Okay, so growth hormone, you can almost think of it as it's kind of getting your body ready to grow. So the reason why I erased that glucose is because the growth hormone is going to increase blood glucose. But insulin-like growth factor, this is the part where you are actually doing the growing, so you're going to be using the glucose. So this is actually going to decrease the amount of blood glucose. So when we talk about some of the drugs later, it does make a little bit of a difference as to what the side effect of it is. Okay, so this is the general picture of what the whole pathway is, and now let's plug in some of the drugs. Okay, so you can have two problems with this. Essentially, you can either get too little growth or a little too much growth. So we can talk about let's talk about the too little growth. So too little growth. So if you have too little growth, you want to make them grow. So the treatments for too little growth is basically you can mimic growth hormone. So you have the somatropin, and this is a recombinant human growth hormone. Okay, so let's go back up. So basically, somatropin would be here. It just mimics growth hormone. So it would go through both pathways. It would go to other tissues, and it will also go to liver, and then eventually it'll go to, the liver will make more insulin-like growth factors. So this will augment the effect of both growth hormone and the insulin-like growth factors. So if you want someone to grow, this is the ideal way to do it. So this is used for, I think, kids that are too premature for their age, and it's used for HIV/AIDS patients that are having like the muscle wasting and things like that. But there is another problem in which you would give them this one. So there's a drug called Mecassermin. So this one is a recombinant insulin-like growth factor 1. So the only time you would use it is for some reason you can't use the growth hormone. And there is a disease where you are basically not sensitive to growth hormone, so you don't have that right receptor. So growth hormone insensitive, and that's the Laurent dwarfism. So if that's the case, the next best thing would be to give them the insulin-like growth factor. Okay, so this is pretty straightforward. There's only 2 main drugs for cases where you want them to grow a little bit more. And now we're going to talk about what happens, what do you use if they're growing too much. So acromegaly type of problems. So to treat too much growth, all right, so like acromegaly, treatments. So for that, you have several different options. We can go all the way up to here, give something that would mimic somatostatin, and that would shut off, it would tell anterior pituitary to make less growth hormone. Or you can work on the growth hormone receptors on these tissues. So the here and here, there are also drugs for that. Okay, so the one that mimics the somatostatin, that's the octreotide and lanreotide. Okay, and these are the somatostatin analogs. And so the treatment for acromegaly kind of makes sense. So you can use that for acromegaly. But another important use is it's also used to treat carcinoid syndrome. So if you recall, in the GI, somatostatin is also inhibitory on many things in the GI. So when you have carcinoid syndrome, you tend to have all of these things upregulated in your GI tract. And it's also used to treat things like viapioma, a lot of those pancreatic tumors. So this is actually pretty important. It comes up quite frequently. And let me just add this here. So this will be octreotide. And then the other one will work the same way. All right, So another option to treat something like acromegaly, you have a drug called pegvisomant. And this works at the growth hormone receptor. So it's a growth hormone receptor antagonist. And this one essentially would only be for acromegaly. Okay, so it's up here, pegvisomant. Okay, and then these are pretty straightforward. There's another one that sort of works for this, but it's not at high concentrations it'll work. So if you recall, if you have dopamine, so dopamine, it normally works to prevent prolactin. But at very high concentrations, it can also prevent the growth hormone from release. So let me put high concentration, high dose. So at very high doses, it can also prevent growth hormone from being released. So there's the dopamine. And there's a drug, bromocriptine, that's a dopamine agonist. So bromocriptine. And this one, at very high concentrations, it could inhibit this pathway, but more commonly it's used for decreasing lactation. So bromocriptine. Okay, so you have the low dose, decrease prolactin. High, you can also inhibit the growth hormone release. Okay, so this is about it, except I forgot to mention one thing that I pointed out earlier, which is this one, mecastermin. So if you look at what I mentioned about blood glucose before, when you use growth hormone, it gets your body ready to grow, so it makes the glucose more available in the blood. But when you're actually doing the growing, you're using up the glucose, so your blood glucose actually decreases. So that would be one of the adverse effects of mecastermin. So adverse effect would be hypoglycemia. Okay, and then this is pretty much all you need to know in terms of growth hormone. Are there any questions with this? Nope. Okay, let me just pause this video. Which button?